And we're back within the community this week, and we are talking about American Red Cross and specifically blood service. And I have Terry with me, the regional account manager for the Fredericksburg area Red Cross. How are you doing?
I am well. How about yourself?
I am doing well, and I'm very excited to talk about this because we've all heard of the American Red Cross. We've all heard of blood donations, blood drives, but sometimes we don't realize the impact that that can really give to somebody who may need the blood. So Terry, I'm going to let you take it away. And what I really want to start with is, how important is it to give blood?
Well, donating blood is crucial. Right now, we don't have a way of fabricating or synthesizing blood. Probably we will in a few years from now. I think they're working on it. But right now, the only way we have of extracting blood is for people to actually take the time to come into a blood drive or a donor center and roll up their sleeves. Now, that one donation, can actually save up to 3 adult lives or 8 babies' lives. We have the gift of life in our veins, and most people don't realize the impact that they can have. The American Red Cross is tasked with the largest job of all in terms of blood collections. We must collect 14,000 units on a given day to meet our goals nationally. And so that's a lot of cookies and orange juice.
Yeah, it is.
But we do it, and the way we do it is by having various blood drives throughout the community. And Fredericksburg, has been a wonderful place for, stepping up and meeting some of the strict requirements we have in terms of meeting these goals. Doctors have to have blood to operate. Without blood, people die. That's the simple fact of it all. So it really is a matter of life and death. And sometimes people think that we may be a little overly dramatic when we're talking about blood donations, but it is a very serious thing. People do not realize it, but every day we have people who need cardiovascular surgical procedures. We have people who have sickle cell disease. We have people who have all kinds of cancers of various kinds. Many people don't realize it, but the need for blood is constant because people who have cancer need the blood for their therapies, for all kinds of therapies, chemotherapies and other therapies, so that we can make sure that they are able to maintain a decent lifestyle and be able to hopefully overcome whatever their cancer situation is. Blood is divided up into usually 3 components: red cells, platelets, and plasma. And we call it component therapy. When the blood is processed and taken to the hospital, the reason we say you can save up to 3 adult lives or 8 babies is because we can take each of those components and actually use them for various therapies.
Oh, wow.
Plasma, for example, which is used to transfer the cells, can actually be used for burn victims, specifically for their treatments. We have platelets, which are used to basically for clotting issues for patients, to actually help, in that process. And that alone, can help with cancer treatments of various kinds. And then we have, the red cells. The red cells, of course, carry the oxygen, in the blood. And those red cells, we always need red cells. And we take the whole blood from patients and use it for trauma situations and so forth. One of the important things to realize is that the need for blood never takes a holiday. And, of course, we have holidays like the 4th of July.
Coming up.
And, we have a lot of people who are going to be getting out of town. And that means they're going to be traveling, and as they should, and enjoying their holidays with friends and relatives. Unfortunately, we have a high incidence of traffic accidents and so forth, and that makes the demand go right up. Another thing that increases blood demand is people like to take their nips and tucks. They like to get the surgical procedures they would like to do during the summertime when they're off from work, and those types of surgical procedures go up. There are other factors that also increase the demand. So the demand for blood in the summertime specifically, and I have to emphasize this, is really important because the blood demand goes much higher because of vacationers. And our normal donors, of course, who donate on a regular basis, generally speaking, they are away on vacation or enjoying themselves. And so, but the demand is still there. The demand is higher. So we actually are seeing a situation where the demand goes up and the donor base drops off. So during that time in the summer is where we really need some summertime holiday heroes to come forth and help us over the hump. And we have a lot of very, very wonderful, compassionate people who regularly donate. You can donate every 56 days. So every 2 months, a person can donate blood.
Okay.
All that we ask is that you be at least 16 years of age with parental consent, 17 years of age, if you can donate, legally you can donate without consent. But, we leave that up to parents and high schools and so forth. And
what's the significance of the 56 days?
According to the FDA, the Food and Drug Administration, and they are the ones who actually determine what we can and cannot do and so forth, 56 days is the amount of time it takes to actually reestablish and replenish, red cells.
Oh, okay.
Now, people don't realize it, but blood has a shelf life.
I'm sure.
Yeah, the shelf life is up to 42 days, 35 to 42 days, 5 to 6 weeks. After that, we can't use it anymore.
Okay.
So that's why I have to come back and keep haunting corporations, businesses, churches, high schools, military installations, wherever we can get people to roll up their sleeves because of that deadline, as far as the usage of blood. But, everyone who donates does a wonderful community service because it helps us to maintain a safe and adequate blood supply at our area hospitals.
Okay.
It makes it so that we are able to do some things, that perhaps, are miraculous in the sense, that without those blood donations, they just simply would not happen, especially with young children, and people don't realize it, but we have children who need the blood badly because they have all kinds of NICU procedures and things like that. And they are constantly in need, as far as cancer therapies of various types, and we need the blood for them, and of course for everyone, and especially for all nationalities. We like to stress that because we need a diverse donor pool, and we are stressing very much the importance of people who have the sickle cell trait, or people who can help us out with those who have the sickle cell trait to help them with their medical procedures, because to be frank with you, that is a disease that is a malformation of the cells. It is prevalent among African Americans and among Hispanics, but primarily among African Americans.
Okay.
And we really have no known cure for it. Matter of fact, we've been working on it for a long time, but at this point in time, there's no cure for sickle cell. It is a very painful, horrible disease, and the only thing that can be done to reduce the incidence possibly of stroke or heart attack or other medical problems is to transfuse them. But they have to have a special blood type. And that's where types figure in. Well, that's why everybody who comes to donate actually is tested for the sickle cell trait.
Oh, okay.
You may be carrying it and may not even know it. And we can use your blood to help those who are suffering from this horrible disease. In fact, throughout most states now, they're actually testing newborns for the sickle cell trait. And our priority right now with the American Red Cross is to really get to work on expanding the awareness of the need for sickle cell donations and those who might have the trait, especially among African Americans, minorities, who may be able to, perhaps donate more frequently than they have been in the past, knowing that their blood type has rare antigens like the U negative and the Duffy cells, things, that are like 1 out of 1,000. So, but every type is a good type, and I like to stress that. I know you're curious about which type is the best type.
I was just about to ask you. You're reading my mind.
The best type, Tiffany, is the blood type that is on the shelf and ready to be used, by doctors who need to do their medical procedures. But as far as the need for blood and the use of it, O negative is the universal blood type. That blood type is I call it the answer to all of our problems, the solution to everything, because it can actually be transfused to anyone of any blood type.
Okay.
But we have the rest, the A's and the B's and the O's.
Yep.
They all work together, but the universal types are very important to us because we can save more lives in less time, with O's and O negatives. But as I said, every type is important, so we don't want anyone to feel,
you're not going to shoo them away.
No, we need all blood types to supply, our very, very demanding requests, from hospitals. And you never know when a certain blood type, it drops off. Every day we get, updates on what the hospitals need.
Right.
But don't feel that because you have maybe an A positive blood type, which is more common, that your blood type is any less important than an O negative, because it varies, from day to day.
Yeah.
But the important thing is that you take the time to donate. And I will give you this figure, that every 2 seconds, someone somewhere needs blood.
Wow.
Did you know that?
I did not.
That's right. Every 2 seconds. And guess how many people actually donate once a year?
I'm going to go with not someone every 2 seconds.
No, actually 3%
Really?
of the population donate once a year.
Oh my gosh.
And the reason for that is varied. There could be, it's not just being apathetic about doing it. Some people can't because of medical reasons.
Right.
And there are some people that can't because of their jobs and so forth. And we really like to emphasize the benefit that we have from those who give regularly, because when they give regularly, they're really helping us to maintain that flow that helps medical procedures to progress. Nothing is more intimidating, I would think, for a physician, and doctors aren't easily intimidated, than for them to look at the family and say, I'm sorry, we just don't have enough of the blood type to complete that medical procedure. Yeah. And it could be a matter of life and death,
Well, and it's interesting you say that, because, I think it's become a background a little bit when we hear another blood drive, and you don't think how impactful it can be. Oh, they must have enough blood. I don't need to do that today,
We never get enough blood.
Exactly. And so to be able to say that, and that as you said, every 2 seconds, someone needs blood.
Right. Every 2 seconds.
Only 3% every year actually donate blood. Those are staggering numbers.
Yes, they are. And, we know that we're up against a very difficult challenge, but fortunately, we have enough people who are willing to step up and donate and give blood. Some of them, are first timers. Some of them, have been giving for years, have given gallons. And I just have an utmost respect for those who do that, because these are people who are giving of their time. And their willingness to step forward and help us out on a regular basis and help, reduce summer blood shortages and when times are tough, especially, we can count on them to come forward. And I will tell you this, that most people have never donated blood, but we would like for them to try it out. It is not really all that difficult or all that painful.
I was just about to ask you, what is the advice you have for people who may be afraid? Because, everyone has that fear. Some people have fears of needles. Some people have those fears. Oh, gosh, it's going to be so painful.
Yes.
So, what would be the advice you would have?
Well, we say that the number one reason why people don't donate is not because of the needle. You know what it is?
I do not.
They say it is no one ever asked me.
Oh, interesting.
So I am a professional asker, and
I like the job
I
title.
like to ask everyone, to consider donating blood, because you may not know the life you may impact by donating blood. And the important thing to understand is that your blood type may be the one, that we really need at a designated time, and only you are the one who can give it. We ask people to consider donating, not from the standpoint of doing something that is extraordinary, although it is in a way a miraculous thing, but all you need to do is show up.
Yeah.
Matter of fact, it is not very painful at all.
Okay.
It's a little pinch and a little burn, and it's all downhill from there. When you show up at a blood drive, we treat you like gold, because you are gold. And then, of course, we take a little test of everything to make sure you're okay. You may call it a mini physical.
Okay.
We take your blood pressure, your pulse, your temperature, and your iron. We check out on your meds to see if you have the medications that are compatible for donating blood. And if you're good to go, then you get on the bed for 8 to 10 minutes. Get that?
Oh, wow.
That's all it takes, 8 to 10 minutes. We ask you to give yourself 45 minutes to an hour, but that's because of the preliminaries, the testing and so forth, and the registration. But, that 8 to 10 minute period, we take a little less than a pint of your blood, and guess what? You will replenish the fluid within 5 hours.
Really?
Yes, your body is a blood manufacturing machine, and you will be fine. You can go back and do your normal activities.
Okay.
As long as you don't go out and run a marathon or do anything extremely strenuous.
Good to know. Not going to run a marathon afterwards.
But you'll be happy knowing that you are doing something that is heroic. We call them heroes because you are. Where can you be a hero just by laying back in a bed for 8 to 10 minutes, putting out your arm, having some orange juice and cookies and whatnot, and then get up, and you have saved lives. That is, something that you will not be able to do, I don't think, anywhere else. But with the American Red Cross and area blood drives or going to the local donor center, you're able to do that. And we really appreciate those who take the time to do it. We know that not everybody can,
right?
But if you have never tried it, we ask you to try it out,
And for people who have never tried it, let's explain the actual blood drive in terms of how do you need to schedule a time? Can you just show up to blood drives? How exactly can you donate?
Actually, we have online all of the blood drives listed. So you can go to redcrossblood.org and find out where all of our area blood drives are.
Oh, awesome.
And you can actually call 1-800-RED-CROSS and schedule your donation.
Okay.
That's 1-800-733-2767, and they will schedule your donation. If you want to go to the website and do it yourself, you can do that. But we make it easy for you as possible. You schedule your blood drive donation appointment, and when you show up on that day, we take you at that exact time. Now, you can walk in from time to time.
Okay.
But for scheduling purposes and making sure your time is not wasted and that, we have in a very efficient process of getting people in and out on time, we suggest that you go ahead and make an appointment if you can.
Okay.
If you can come to the local donor center, they can do it there at your convenience, or you can come to a blood drive and you can sometimes walk into some of them. Some of them are closed because they're corporate blood drives.
Right.
We do go to places like the FBI and other places. So those are not open to the public, but many of them are community blood drives. And so you can come, and we welcome you to come. And if you can, bring someone with you. We ask you to bring a friend, because sometimes you may be afraid to do it. But if you bring someone with you, you both have the experience and you have a positive experience. We know that you'll come back and give again.
And I'm speaking with Terry, the regional account manager for Fredericksburg's Area Red Cross. I will say I learned so much more about blood from you today than I ever knew before. So thank you for the knowledge and for actually calming a lot of the fears that I'm sure everyone who's listening right now is like, well, it may be pretty easy just to kind of go and see what happens. As you said, bring a friend. It's always better with a friend.
Yes.
So thank you so much for being on today.
Thank you, Tiffany.
And for telling me all the importance about blood. And if you are out there and you want to donate or you haven't before, try it with a friend. Thank you.